Welcome back to 247 Health Matters. I am your host and health coach, Dr. D. It's a pleasure to be with you once again. The last time we looked into underactive thyroid in this series on thyroid awareness, and today we'll be looking at the other flip side. That's the overactive thyroidism. So today we're going to be looking at hyperthyroidism, which can mimic so many conditions, especially stress. You have palpitations, weight loss, unexplained weight loss, and anxiety. Commonly, people will say that somebody is stressed. However, hyperthyroidism is a common cause of these three symptoms that I've mentioned. So let's look at causes of overactive thyroid or hyperthyroidism. The number one on the list will be Graves' disease. The condition was first described by an Irish physician in 1835. So Graves' disease is an autoimmune condition. We talked about autoimmune diseases because essentially what happens is that antibodies are released to stimulate the thyroid receptor. So basically what happens is that there is an exaggerate or elaboration of thyroid hormone into the circulation in large quantity. So the thyroid gland is, in this instance, is not under the control of the master gland, because what is stimulating the thyroid gland to produce thyroid hormone are these antibodies. And there are quite a number of risk factors for Graves' disease, which include stress. So one of the triggers of Graves' disease is stress. Of course, also cigarette smoking and some infection also has been implicated. It's not difficult to identify an individual with Graves' disease. They tend to have bulgy eyeball, and then they tend to have lose weight, a lot of weight, and they tend to have palpitations. Those are the three things that you find. Of course, they also tend to have enlarged thyroid gland, that's goitre. The next cause of overactive thyroid tend to occur in communities where there's iodine deficiency. When there's iodine deficiency for a very long time, people tend to develop lumps within their the thyroid gland. So this is called multinodular goitre, because the lumps are many. So these lumps at some point may become autonomous. That means they begin to function without the influence of the TSH, the thyroid stimulating hormone. And when they take this life of their own, the level of thyroid hormone that is released is in excess because it's not under the control of TSH. So this also is a major cause of overactive thyroid. The next is thyroiditis. That's inflammation of the thyroid gland, which also usually is preceded by upper respiratory tract infection, usually viral infection. And of course, people who have this tend to have fever, and then of course the thyroid gland tend to be painful. So this is the only very few causes of painful goitre. So when you have this condition, you need to differentiate it from Graves' disease and toxic multinodular goitre that are usually painless. Of course, any swelling within the neck can cause some discomfort, but hardly painful. So, but thyroiditis oftentimes tend to be painful, usually for a short period of time. Of course, once the inflammation, subsides, the pain also disappears. But of course, because of the inflammation within the thyroid gland, there is leakage of the thyroid hormone into the circulation in excess. Of course, that's also within weeks is short-lived. Sometimes may return back to normal, or sometimes some people may even become hypothyroid. The next is Iodine excess. I think we did mention that during our last conversation on underactive thyroid. The iodine can cause either underactive or overactive thyroid. So iodine can be taken in form of contrast, like when people do some imaging procedures like CT scan, they introduce some, iodine dye into their body. So that also can cause overactive thyroid. Also taking iodine in form of supplements like kelp, of course, that also can give rise to overactive thyroid when it's taken in excess. Of course, when to those who are on level thyroxine, maybe supplementation because of hypothyroidism, sometimes they take it in excess. That also, of course, can also lead to overactive thyroid. Last but not the least are medications. I mean, the list is endless, but however, I mentioned just a few. Of course, drugs like amiodarone that they use for heart problem has been implicated, and there are a few number of other medications also that can cause overactive thyroid. So how do I recognize somebody with overactive thyroid? The most noticeable symptom is unexplained weight loss. Now mark the word unexplained. That means there is no reason you can attribute to this weight loss, because the individual is not actively trying to lose weight. So of course, weight loss is accompanied this condition. But sometimes, if the individual eats in excess, they may be able to compensate for it, especially in the young people. But most elderly people usually will lose some weight. It's even been documented in some cases where people have overactive thyroid and they gain some weight, net weight. The next is palpitations. That means awareness of heartbeat. So the individual will complain that I just find out that my heart is beating fast. So typically, that is one of the symptoms of overactive thyroid. And of course, tremors, anxiety, restlessness. Of course, sometimes heat intolerance or oversensitive to heat. So the individual is in a room with normal ambient temperature, and yet he's saying, please, can you put on the fan? Can you put on the AC? So he or she wants to remove his or her clothes. So that is one of another very important. Of course, this can also occur in quite a number of conditions, like in women who are postmenopausal or men who have androgen deficiency. So there are quite a number of other, conditions that can mimic this. Then, of course, the next is insomnia. So the individual has problems sleeping well, or the sleep is interrupted. In Graves, I did mention that in Graves' disease, they also tend to have, bulgy eyes, and then sometimes it's red. I mean, so you will easily recognize someone who has Graves' disease because the eyes are prominent. And of course, they have what we call it stare gaze. Sometimes it could be red. Sometimes they could even tell you that, oh, I'm seeing double. So that's the extreme situation. Well, other things like increased frequency of stooling. So the individual just goes to the toilet frequently to stool. Sometimes it may be accompanied by diarrhea, that means watery stool. But sometimes it just be frequency, as many as maybe like 10, even more than 10 times in a day. Okay, I mean, it's strange. So the change in bowel habit is so dramatic, and it's having a lot of impact on this individual. The another one is increased urinary frequency. That reminds me of a woman, an elderly woman that I saw a couple of months back, whose only symptoms were weight loss and increased frequency of urination. Initially, I thought she had urinary tract infection, or maybe she had diabetes. We did all the screening to exclude other causes of urinary tract infection or urinary frequency. And then I said, okay, let's do, because she complained of some modest amount of weight loss. But then we found out that at the end of the day, she has overactive thyroid. Unbelievable. So increased urinary frequency is also one of the symptoms. And of course, also, there could also be menstrual irregularity. Of course, just like, just the opposite of what happens in underactive thyroid. So in this case, the menstrual cycle tends to be shortened and the flow tends to be very little. So sometimes, like I said, especially in the elderly, they tend to be more apathetic and the symptoms are not so overt. So it could easily be missed in them. Same thing goes for pregnant women. It may also be masked in pregnant women because, in pregnant women, for a number of reasons, they may have some degree of palpitation because the heart rate is increased during pregnancy. So this also can be masked in them. You may mistaken it for the pregnancy issues. When this condition, overactive thyroidism, not picked in time or is unrecognized, it may cause some problem, especially in the elderly individuals. It can cause abnormal heart rhythm, which can also lead to a lot of problems. And of course, it can also cause thinning of the bone, osteoporosis, especially in the older population. It can also cause what is called thyroid storm, which is a life-threatening condition because there's exaggeration of all the symptoms that we've described to the extent that the patient can even become unconscious. So how is overactive thyroid diagnosed? By far the symptoms, especially if the individual has all the florid symptoms that I've described, it's not difficult to identify. Then of course you have to confirm it with by test, doing your thyroid function test. So the thyroid function test will show that the thyroid, that's the thyroid hormone T3, T4, especially T4 will be high and the TSH will be low. So that is very easy to diagnose. Now, beyond that, you can also do some imaging procedure. There's what we call the thyroid scan, which can show you the nodule, or you can also show you if the look of the thyroid gland. That, of course, doesn't give you the diagnosis though. Then people also do what they call the optic scan, the radioactive optic scan, which shows, we can also differentiate the different types of overactive thyroid that I've mentioned, to be able to differentiate, for example, whether it is due to thyroiditis from Graves. There are quite a number of other investigations that you can do, like the antibody test, that would also confirm, especially if it is due to Graves' disease. This brings us to the end of the first part of this topic on overactive thyroid, that's hyperthyroidism. And next time we'll be looking at the treatment options available. Please like, share, and subscribe to our channel. Till next time, I remain your health coach and friend, Dr. D. Remain healthy.